Hello, my name is Janella Scott, and I am a graduate student at Lamar University. For my nursing research course, I chose to do my prospectus paper over integrating caring theory and purposeful rounding in a medical surgical unit. Due to the nature of the healthcare business, patient satisfaction and safety are critical aspects. Therefore, many hospitals constantly seek ways to make improvements in order to receive better scores on patient satisfaction surveys, reduce falls within the hospitals, and establish a more therapeutic relationship between nurses and patients. The nurse spends the most time with the patient and is responsible for their safety, providing quality service, compassion, teaching, and giving their patients respect. However, caring is perceived differently by patients and nurses due to their roles. Sometimes nurses become overwhelmed with tasks and miss things such as interacting with the patient and being present more often in the room, which can lead to a change in the relationship. Caring has a huge impact on patient satisfaction and shapes how patients feel about their hospital stay. The purpose of this study is to increase patient satisfaction, decrease patient falls on a medical surgical floor, and establish a therapeutic relationship between nurses and patients. The study will be comparing the implementation of purposeful hourly rounding regarding the three P's: pain, position, and personal care, such as restroom breaks, versus the traditional random rounding, while incorporating Watson's caring theory. For the literature review, I searched through various articles and used terms such as intentional rounding, purposeful rounding, Watson's caring theory, decreased call light usage, and increased patient satisfaction. The articles used demonstrated the implementation and impact Watson's caring theory has in the hospital setting. A lot of the research indicated that there were ways to improve patient satisfaction and to decrease their risk for falls. There were even articles regarding practitioners and the medication that was prescribed, which increased a higher risk of falls in the elderly population, and that medication reviews should be done more frequently. The nurses must be aware of the medications that can contribute to increased falls among patients and be more alert during rounding. Another research article was done to get an in depth perspective on patients' thoughts on satisfaction of care. The use of this study is important for this project because it gives insight regarding the needs and expectations of patients during their hourly rounds. The information gained through the article allows nurses to know what satisfactory care is to their patients. For my prospectus, I had three research questions. Is there a correlation between purposeful rounding and decreased patient falls and increased patient satisfaction? Does purposeful rounding enhance the nurse-patient relationship? Does purposeful rounding lead to a happier environment among staff and patients? There are limitations in this project, such as the use of nurses only instead of including all healthcare personnel. Also, due to the sample only being taken from older adults aged 65 and older, the data could be biased. The study is also conducted on a medical surgical floor, which could be an issue because the results may vary in the emergency department or intensive care unit. However, the delimitations for the project would be not using an open-ended questions for the survey, inclusion of only older adults 65 and up, and the use of Watson's caring theory. For the project, my assumptions will be that the numbers of fall will decrease after implementation. Honest feedback will be received from the nursing staff. The nurses will be aware that sometimes they do forget the three P's: pain, position, and personal care. Also, patient satisfaction will increase after implementation. For the theoretical framework, I use Dr. Gene Watson's human caring theory. Watson's caring based model into practice can potentially bridge the gap that has been created due to lack of communication, responsiveness, timeliness, and empathy. If the caring model is taught when staff is hired and on an ongoing basis, the views of the hospital can change. Education is a primary factor when using the caring model. The model leads to increased patient satisfaction, improves patient outcomes, and creates a positive work environment. The introduction of Watson's caring theory, along with purposeful rounding, is about making the change from task oriented care to patient centered care. This project is non experimental convenience sampling. The sample will consist of older adult patients ages 65 and older from a medical surgical unit. All genders and ethnicities will be included in the study. The data will also include patients who are at a higher risk for falls. Patients who will be excluded are patients who are under 65, patients who are not at high risk for falls, and patients who are not admitted overnight to a medical surgical floor. Data will be collected based on the feedback received from the Hospital Consumer Assessment of Healthcare Providers and System, also known as HCAPS. An hourly rounding log sheet will be placed in each patient's room, and fall risk data will be used based on comorbidities, age, medications, admitting diagnosis, and post surgical procedures. In order to evaluate and analyze the data, HCAPS data will be used, hourly rounding logs, and patient fall risk questionnaire. Patients will be given an HCAPS survey upon discharge from the hospital, and feedback will be analyzed to determine if patient satisfaction increased after the implementation of patient-centered care using the purposeful rounding system. The data will be analyzed using the SPSS statistical software, where the HCAPS data will be considered ordinal based on patient responses, and Spearman's Rho will be used. The number of falls will also be compared to previous data before the project was started, and this will be used as a baseline to determine if falls decreased. In summary, implementation of a caring-based theory and purposeful rounding can lead to significant changes within the hospital for patients and staff. This project can eliminate the issues experienced between nurses and patients to deliver safer care and establish a therapeutic relationship from admission to discharge. This project can also change the way healthcare is delivered and increase patient outcomes and patient satisfaction hospital-wide. This concludes my PowerPoint. Thank you for listening.